Periodontal pocket, classification and types. Gingival sulcus is the V-shaped space between the gingiva and tooth. A sulcus is 2 to 3 mm deep and a normal finding with no attachment loss. Whereas periodontal pocket is a deepened gingival sulcus which is more than 3 mm deep, formed by loss of attachment, and it is an important feature of periodontal disease. Pockets can be classified into different types based on 3 criteria. Based on level of gingival margin and attachment, relation of base of pocket to alveolar crest, and based on number of surfaces involved. Based on the level of gingival margin and attachment, pockets are classified as gingival and periodontal pocket. Based on relation of base of pocket to alveolar crest, they are classified as suprabony pockets and infrabony pockets. Based on the number of surfaces involved, pockets are classified as simple, compound, and complex pockets. Looking into classification based on level of gingival margin and attachment. In normal condition, the gingival margin will be 1 to 2 mm coronal to CEG, and the attachment will be at the level of CEG. In gingival pocket, the sulcus is deepened by the coronal migration of the gingival margin. There is no change in level of attachment, that is, the attachment is still at the CEG. Hence, it is also referred to as pseudopocket. Whereas in periodontal pocket, the sulcus is deepened by the apical migration of the gingival attachment. In most of the cases, the level of gingival margin might not change. On comparing between gingival and periodontal pockets, the gingival pocket is formed by the coronal shift in gingival margin, whereas in periodontal pocket, in most of the cases, the position of margin is unaltered. In gingival pocket, the level of attachment is still at CEG, whereas in periodontal pocket, the level of attachment is apical to the level of CEG. There is loss of attachment. That's the comparison table. Moving on to classification of pockets based on relation of base of pocket to alveolar crest. Consider this the level of alveolar crest. In suprabony pocket, the base of the pocket will be coronal to the crest of the alveolar bone. Whereas in infrabony pocket, the base of the pocket will be apical to the crest of the alveolar bone. In suprabony pocket, the pattern of bone loss will be horizontal, and in the infrabony pocket, the pattern of bone loss will be angular. Moreover, in the suprabony pocket, on the facial and lingual surfaces, periodontal ligament fibers beneath the pocket follow the normal horizontal or the oblique course between the cementum and the bone. Whereas, in the infrabony pocket, on the facial and lingual surfaces, periodontal ligament fibers follow an angular pattern of the adjacent bone. In suprabony pocket, interproximally, transeptal fibers that are restored during progressive periodontal disease are arranged horizontally in the space between the base of the pocket and the alveolar bone. Whereas in infrabony pockets, the arrangement of transeptal fibers are oblique rather than horizontal. To summarize the features of supra and infrabony pockets, in suprabony pocket, the base of the pocket will be coronal to the crest of the alveolar bone, whereas in the infrabony pocket, the base of the pocket will be apical to the crest of the alveolar bone. In the suprabony pocket, the pattern of bone loss will be horizontal, and infrabony it will be angular or vertical. Interproximally, in suprabony pocket, the transeptal fibers are arranged horizontally, and in the infrabony pocket, they are arranged in an oblique manner. On the facial and lingual surfaces, the course of PDL is horizontal and oblique in suprabony pocket, whereas it has an angular pattern in the infrabony pocket. Finally, looking into the classification based on the number of surfaces involved. Simple pocket involves only one surface. When 2 or more surfaces is involved, it is termed as complex pocket. In this example, the pocket has involved both mesiobuccal as well as the midbuccal surfaces. Hence, it is a compound pocket. Finally, pockets can also be spiraling, that is originating on one tooth surface and twisting around the tooth to involve one or more additional surfaces. In this example, the pocket starts at the proximal surface, turns to the buccal surface, and spirals into the furcation. Such pockets are called as complex pockets, and they are commonly seen in the furcation area. To summarize, the pockets can be classified into different types based on three criteria: based on level of gingival margin and attachment, relation of base of pocket to alveolar bone, and based on number of surfaces involved. Based on level of gingival margin and attachment, pockets are classified into gingival pocket and periodontal pocket. Based on the relation of base of the alveolar bone pocket to the crest, they are classified into suprabony pocket and infrabony pocket. Finally, based on the number of surfaces involved, they are classified into simple, compound, and complex pockets. Remember the criteria with this mnemonic: GABAS. GA is for gingival margin and attachment, BA is for base of pocket and alveolar crest, and S for the surfaces involved. Thank you.